I was diagnosed with both rectal and testicular cancers in 2011. A life-changing blow for anyone. The weight of a single cancer diagnosis alone was devastating enough, let alone 2 primary cancers. With a health scare and diagnosis of any kind came a barrage of questions in my mind. At that moment, there was a lot to organize. I remember my mind racing at 1,000,000 miles per hour. Survival rates, treatment costs, side effects of treatment, and adjusting to life with a permanent stoma consumed my thoughts like navigating an intricate maze with no clear path. As a founding member of SingHealth Patient Advocacy Network, SPAN, the journey of creating this incredible community was both personal and inspiring. The vision of a supportive network of patients and caregivers emerged from my own experience and the desire to connect with others facing similar challenges. I believe that we can all forge a path where shared experience, fears, and triumphs intertwine, creating a powerful sense of belonging and empowerment for all who become part of the SPAN community.
I was a caregiver at age 28. My son was born with tetralogy of Fallot's, which required an open heart surgery at 18 months. Being a young mother, I was at a loss of how to take care of my child. I was lucky to have the support from my parents and siblings. My son had been all well till 4 years ago. At the age of 26, we were told that his heart valve was not functioning and had an implantable pacemaker inserted. Back when my son was 17 years old, I was once again trusted into a caregiver role for my husband. With young onset Parkinson at age 45, I couldn't help but feel overwhelmed by responsibility. Trying to pull myself together so as to be strong for my husband, I learned more from Parkinson Warrior that he needs constant exercise every day in order to prevent the muscle getting wasted. When he was 57 years old, his condition gradually took a turn for the worse. He decided to go for the deep brain stimulation surgery and recovered well. Just last year, my husband received the Singapore Health Inspirational Patient Partner in Care Award, and it was during that time where we came to know more about SPAN. I was instantly drawn to the vibrant and innovative community they had created. Through SPAN, I was able to share more with my knowledge as a caregiver on Parkinson's disease, providing important patient and family perspective to enhance and improve safety and care experience.
When I received my colorectal cancer diagnosis, anxiety, worry, and fear overwhelmed me. It was a moment of immense uncertainty, and my mind was filled with countless questions. The weight of the unknown pressed upon me. How would I cope with this diagnosis? How would it impact my daily life? These concerns clouded my mind, making me feel uneasy. I discovered SPAN through word of mouth, social media, and friends. I learned about this remarkable community of support. I'm committed to providing patient care and inspiring fellow survivors through dance and music activities. Sharing experiences with fellow survivors has been empowering. My own cancer journey taught me to acknowledge, to accept, and to adjust, leading to a focus on a healthy lifestyle.
Patients at the heart of all we do is our common purpose, and we strive to bring the best outcome and best experience to our patients and their loved ones. An important ingredient to allow us to do that well is to engage our patients and our caregivers. The SingHealth Patient Advocacy Network, more fondly known as SPAN, at SGH and SGH-DEM, strives to do just that. We are so grateful that we have a group of patients and caregivers who step up so generously to give of their time to participate in focus groups, work groups, retreats, giving us valued insights and perspective into a whole repertoire from processes to communication materials. And I'm so heartened that as an organization, we are confident enough and mature enough to truly value and respect the perspective that the caregivers and our patients are giving us. SPAN, they help us sharpen, they prompt us, they activate, and they nourish our conversation and our thinking. Together, when we open our hearts and minds, we can and we dare to do better.
Our mission at SPAN is to promote patient-centered care by collaborating with patients and caregivers to improve the quality of care for everyone. An unforgettable moment for me would be when our friends at SPAN actually wrote a newspaper editorial against healthcare worker abuse. So it's really quite inspiring and heartwarming to have patients and patient advocates backing us up, supporting us, and united in this goal of improving healthcare for everybody. You can make a difference at SPAN. You have the power, you just have to volunteer, to participate, contribute, and share your unique skills.